6:04 p.m. We will have our invocation by our Vice Chair, Commissioner Gibson.
Let us pray. Our God and our Creator, we are so thankful for the many blessings that you've granted unto us, for you allowing us the opportunity to come and serve the citizens of this community and this county. We ask for your guidance and your direction, that all that we say and do will be done in a way that is pleasing in your sight and with the thoughts and best interests of your citizens in mind. For it's in your name we pray. Amen.
Amen. All right.
Were you able to get it, the camera to work?
We have the agenda before you. Are there any changes or additions to the agenda? If not, we need a motion and a second to adopt the agenda.
I'll make a motion to adopt.
I second.
Okay, we have a motion and second. All in favor say aye.
Aye.
All opposed, like sign. The ayes have it and the motion is carried. The next item of business is the regular session meetings from last meeting, August 14th. They were in your packets. If you want to take a minute to review them. After reviewing, if there are not any changes or additions, I need a motion in a second.
Offer a motion for approval of the August 14th regular session minutes.
I second.
We have a motion and second. All in favor say aye.
Aye.
All opposed, like sign. Ayes have it and the motion is carried. Well, we don't have any public forums, so we're gonna move on to the next item, which is the administrative reports. We will have our fiscal update by Tim Martin.
Good evening.
Good evening.
Get that one.
In your package, you have a financial update. This will be the finance up as of September 30th, 2023. The first slide, is it working?
It's not working.
We're going. This is the budget as of September 30th, 2023. Well, first quarter of the year is already over pretty fast. 25% expended is where we should be at this time. As you can see, as a total health department, we are 18.3% spent. So we're currently under budget as far as expenditures. Any questions or concerns? Please notice there are now two new things you'll see on the bottom of that page that says PAVE and reducing infant mortality, which we'll discuss a little bit later. Okay. The next slide will just show you the revenues or what we've collected so far through through September 30th. I apologize because the September numbers are not on this spreadsheet. This is only July and August's numbers. So I will have to make sure September's everything's updated next time. 25% collected, as you can see at 7.4. Like I said, September's numbers are not included in this. Any questions? Okay. Anything else? Discussion? Okay, thank you.
Thank you, Tim. Next, we'll have our monthly activity summary. Beaver.
The activities were in your packet. One thing I wanted to note was on the activity sheet, you will notice that our clinical services are increasing. In July, we had 391 total, 474 in August, and 676 patients services in September. So we are working on improving our clinic numbers. As far as my report, um, this was in your packet, but I wanted to highlight a few things. The renovations, new equipment, mobile unit, I wanted to give you an update. The general clinic renovations are complete. We did get some of the equipment moved back in the room this week. We are now moving to phase 2, which will be our lab. When we were looking at our lab, it actually looked like from the 1970s. I mean, the cabinets and everything was in pretty bad shape. The doors were falling loose and everything. So we're waiting on our quote for that renovation, but we're going to be moving to stage 2, which will be the lab renovations. The mobile unit is finally progressing. The engineer drawings have been approved. The graphics have been reviewed and approved. They have 85% of what they need as far as supplies in, and so they are moving the chassis onto the floor, and they're anticipating a date of completion December of this year. Okay, clinic services. The Partners in Advancing Vaccine Equity grant that we received is progressing. We are scheduling some outreach efforts. We hope to have, I'd say, 3 to 4, Jana, 3 to 4 outreach events in the community to provide flu and COVID vaccinations. The PrEP clinic has rolled out. It rolled out October 2nd, and we've already started seeing patients in that clinic. And the Reducing Infant Mortality in Communities grant was approved, and it starts November 1st. So that's a new program. County issues, abatement of public health nuisance and abatement of imminent hazard. We had talked about that at our last meeting, some of the houses and stuff that we had some concerns about. I have met with Captain Ford. I have talked with April Sneed, our county manager. They have started a solid waste task force, and I was not included initially, but now I am on that task force, and we're looking at some properties now that need to be worked on. I have not seen anything from the public health standpoint yet, but zoning and inspections have already sent out a couple of certified letters that we're waiting on response. But I looked at 2 properties today that I will be sending out some notices on. Staff recognition, was that the next thing?
I understand that there is no sound to our live. No sound. I mean, I wouldn't let that hold us up, but there's.
Oh, okay.
Okay.
So the next thing I wanted to talk about was staff recognition. Um, Miss Betsy was going to try to be here tonight. She was recognized by the Dr. Ann Wolf Memorial Scholarship Award, but she had to have some dental work, so she couldn't make it tonight. But each year, the NCPA offers 2 conference scholarships in memory of former board member Dr. Ann Wolf. The scholarships are offered as a reward and recognition for staff employed at a North Carolina local health department in maternal and child health programs. The scholarships are awarded to 2 recipients to cover registration and basic travel expense to the annual conference. And she attended that last week. So we wanted to recognize Miss Betsy for her award. Okay, the North Carolina GlaxoSmithKline Foundation, in conjunction with the North Carolina Public Health Association, has an award every year. They honor local health departments, public health staff, individuals for innovative collaborative programs that improve the lives of North Carolina children. The foundation works with the North Carolina Public Health Association to coordinate the program, and all nominees and award recipients are recognized at a luncheon at NCPHA annual meeting. This year's meeting was held on September 27th in Concord, and our health department was one of 10 nominated in the state. And we were nominated on child health immunization outreach for the efforts that our health department did in trying to make sure that all the kids could stay in school and get their immunizations. So we're proud of that. And I was surprised, and I was nominated for the Public Health Staff Award. Tim, do you have the little thing that they did? This is a video that they played at the luncheon. So I was totally surprised.
Okay. You think we can share that at our shack meeting
Sure,
Thursday?
sure,
That video
sure. Is it this Thursday?
is this Thursday.
Um,
Congratulations.
the other thing I wanted to say about staff recognition is I'd like to recognize Miss Deborah Rogers. She she has been with the county for 30 years, and our staff is so proud to have her. And I just wanted to recognize her 30 years of service.
The other department updates.
That's it.
That's it.
Okay. Miss Donna's out of team.
Okay. Unfinished business from last time. Do we have any? I know we had that policy review committee stuff that we was talking about. So y'all want to just continue on? Because we have just some policies we have to review tonight, because we never did get together to get that committee. You know, we were supposed to form that and meet like monthly, but we never did continue on that. So we're just gonna review the policies that she sent out tonight and sign off and approve them. So is that okay?
Yeah, that's fine with me.
Okay. So moving on to new business. The departmental focus, emergency preparedness by Jana. Jana Blue.
Good evening, everyone.
Good evening.
I'm Jana. Don't know if I've ever been introduced as our public health and response coordinator, but I do function in that role at the health department. And our North Carolina preparedness and response program is at all the health departments. And what we do is we prepare. So we write plans and we exercise those plans regularly. We function in situations such as disease epidemics or pandemics, right? Chemical, radiological exposure, and also severe weather events are some of the examples of when we would respond. So again, this is done through training and exercise. Right now, we're wrapping up our COVID AAR or after action report that is being compiled starting at the county level and federally. And we are also going we're preparing for our going towards our annual training. And that's typically done in December. So we'll do respiratory fit testing for all staff. We'll get updates from our regional pharmacist team. So we get those updates. We make sure each staff goes through training, and then we culminate that with the actual fit testing and some other training as well. Any questions about the public health preparedness and response program?
Thank you. Oh, Jana, you got another 2022, 2024 strategic plan updates?
Yes, how
Yes.
timely. So we do have for you, was that sent ahead the strategic plan updates? Awesome. So given that that has been provided for you, I will not read through all of those. But we do know that the strategic plan is one of our North Carolina Local Health Department accreditation benchmarks. So that is benchmark 15, which requires an agency strategic plan and that it be updated and utilized to give guidance and direction to the department in the efforts that we use to strengthen the health of our community. And so that is activity 15.1 of the accreditation benchmarks. And we have provided to you today our strategic plan, the most recent, and the annual updates thus far. Okay. So we did we did see some progression in each of the areas. There was one area that you will see in the mental health section that spoke directly to funding. seeking out funding sources, and that was put on hold during fiscal years 22, 23. And the reason that was put on hold was because we had an excess of funding from the pandemic. So we did not have to apply for those funds. Those funds were provided through the state. So that's the only area we have where there was no progress made. Are there any other questions, or can I provide some additional information on our strategic plan updates at this time?
Thank you.
Thank you so much.
Thank you, Jane. Thank you. Next is approval of new funding. The AA 716 vaccination program, $30,000 addition to the rollover amount of $183,952 to bring the total to $213,952. The RIMC grant of $654,364. Tim, can you explain the
16 vaccination, the 716 vaccination program. Miss Amanda went to a health directors conference, health directors meeting, and they had additional funds that other counties had not used. And we're just decided if other counties wanted to use this money, just $30,000, and we gladly accepted that $30,000 to help with our vaccine, COVID vaccine equity, COVID vaccine program. The RMC grant is a three-year grant. It is a 3-year grant, so that total for $654,364 is over 3 years.
What is the RIMC grant?
Reducing infant mortality in the community. So it is similar to the IMR grant that we had previously, but it's a little different. Jana is the program coordinator for that grant. She might be able to fill in a little bit.
I defer to Jana on that.
Come to the microphone, please. Just so the people who are listening can hear. Thank you.
The RIMC program is Reduction of Infant Mortality in Communities program. It was awarded through the state. It will start effective November 1st. Through this project, one of our objectives is disparities. So 50% of our program participants will be minority communities. And we did that because if you look at the data, right, infant mortality rates, almost all of our infant deaths in the previous year that we used for the application were minorities, all but one. Were minorities. So we're really tasked here with looking at reduction of disparities and really engaging those communities to see how we can improve our infant mortality rates.
Is it going to require new staffing, or are we able to push this out with the staff that we already have?
We actually have been able to add on a facilitator. Do you want to speak to the?
I don't know if y'all remember Tariq Hargrove that worked with the school health liaison program. When that COVID funding run out in May, we no longer had a part-time position for him. So he came back in a part-time position for the grant that we got for partnering in vaccine equity. Well, he has participated with Jana and myself in this grant, so he's really familiar with it. So I have requested from the county manager to make him full-time because there's money there for part-time in one grant, part-time in another.
So that is the addition of one part-time staff member. And myself.
Thank you.
So I guess we need a motion and a second to approve this.
Approve both?
Both.
Both, that's
Correct.
both, okay. Offer motion for approval of new funding, both grants, with vaccination program and then the RIMC grant.
Okay, the second.
A second, thank you.
Okay. Okay, we have a motion and a second. All in favor say aye. All opposed, like sign. The ayes have it and the motion is carried. Okay. Next on the agenda, we have the approval of a fee schedule for the influenza and COVID vaccines. Tim?
In your package, you did receive a sheet that I think looks like this. We do know that, I guess everyone knows that the state is no longer going to provide COVID vaccines free anymore to health departments, so we now have to purchase them ourselves privately. We do have a bridge program for people who do not have insurance. That's a separate program that will allow them to get COVID vaccine as well. I do want to start off by saying, before we get in any detail, the COVID vaccine at this point in time is at no cost out of pocket to a person, anyone. So why I say that is because insurance can be billed and the admin fee can be billed. However, if their insurance does not pay, or if they will not have to pay for the COVID vaccines. That may, it's no out of pocket cost to anyone. Okay, so it was before. There's no out of pocket cost to anyone. So you do know that Pfizer and Moderna are the two that has been set aside. I did want to give a little bit of information that I did not think was in that package, just so you'll kind of understand or get an idea of what the health department has given since July of this year. We do not know how many people are going to want the booster. We have no clue of knowing that at this time, but I do have figures of what's from July 1st of 22 to June 30th of 23. We did administer at the health department 476 COVID booster shots. 407 of those were Moderna, and only 51, of course, were Pfizer. The reason I say that, and we only actually gave out pediatric, we only actually gave out 18 pediatric shots for COVID boosters. So as we've not done a whole lot of the pediatrics. So I want to give you that information so we can go on and find out how many we're requesting to order. I will say that Amanda and myself did meet with the county manager, because at the time we had no clue how we were going to pay for this COVID vaccine, because it was not budgeted for us to do so. However, thankfully, the state is allowing us to use one of our COVID grants to actually purchase the COVID vaccine. So that is going to be no cost to the county to actually purchase that vaccine. So we are thankful for that.
That's great.
So we did not have to find some money somewhere in the county to fund the COVID vaccine. The costs for the vaccine, I think you have all on that piece of paper, and the requested doses. The reason it's so high is because, unfortunately, there's minimum orders for the vaccine. I think one of them has a minimum order of 100. I think we finally got that reduced down to 70. So there's a minimum we have to order in order for them to supply us with that vaccine. So to the important part, the actual cost of the vaccine, which is what we do, our fee committee meets and we decide what the actual cost to administer the vaccine is and the vaccine itself is. And the policy says that we increase this by 5% to cover any additional cost. And that is what you will see on the paper before you. So the cost per dose, you'll see the minimum order, requested doses, and in the very last column, you will see what the actual requested fee is. And that is what we will need to have approval of. The Pfizer is still split up between 6 months to 4 years old, 5 years to 12, and then 12 plus. And the Moderna is 6 months to 11 years, and then 12 plus. And the requested fees are there, and the administrative fee is $25 for all. So we just need a motion to accept these prices.
All right, we need a motion in a second to accept these fees. Second. All right, we have a motion in a second. All in favor say aye.
Aye.
All opposed, like sign. All right, the motion is carried.
Any further questions on the COVID vaccine?
So it's no cost to the patient.
It will be no cost to the
Even if
patient.
it's insurance, don't.
Correct.
Okay.
Just like the admin fee, we can bill the insurance. We can't
Yeah.
ask the patient to pay for the vaccine.
Okay. All right.
All right, thank you.
All right, thank you, team. right. Next on the agenda is the selection of a nominating committee for candidates to be elected at the December meeting for the next calendar year. This year went by quickly. It did went by quick.
Mhm.
So do we have any volunteers?
How many people have traditionally served on nomination committee?
It's like two. It's
Two.
two. Two. Diane and I did it last time. So we were requesting that new people
Mhm.
do it this time.
Do you want to, just go over exactly
What we did.
what we did?
We received the phone numbers, email addresses to all members, and we made phone calls.
Mhm.
He split. We did half the one she like. I think you started at the top, and I went to the bottom,
Uh-huh.
and we contacted everybody and asked them who they want to nominate by phone, and then we took their choice and we tallied it up, and then we read them at the next meeting, and
And
then
yeah,
that
and it's
person,
Board chair and
Yeah,
the vice chair.
vice chair, whoever had the most, or did we read all of them?
Um,
Can't remember.
I think we
Think
may,
about
we
it. We
may
read
have read all of
all,
them. Uh-huh.
all that was tallied.
But you probably remember getting the phone calls. from
Yeah.
last year.
Mm-hmm.
I do.
So that's probably what would be the easier process. And it wasn't too bad. Mm-mm. So we have any volunteers?
I will. I mean, I'll serve.
Mhm.
At least
Anybody else?
Dr. Bowling, Dr. Singletary.
I can do it. All right.
Fine, call him.
Okay.
Just ask him.
Okay. Rita,
Okay.
mm. All right. So next on the agenda is the policy reviews. Christine. Yes. So do we need to just go over each one of these and just sign off? Because I know normally we will come and sign off. The health department would be electronic.
Yeah.
Madam Chair, could you just highlight for me,
Yeah.
are there any changes to each of those that you have, Madam Chair?
No, that when I read it was just the revision. I didn't see, because normally when they would have changes, they'll list the changes right in the copy, but I didn't see any. They're just revisions.
So I got two sets of stuff. So which one?
It's the same.
Oh,
Two sets accidentally got put in the packet.
Yeah.
They
Yeah, I
just
got confused.
Okay.
Yeah,
'Cause I
But
was
it
having some too.
yeah, I thought it was a difference too.
Yeah,
I think. the
But there was no
revised dates on the
changes
back.
in any of the policies.
yeah, they would highlight them if it would highlight the changes.
Right.
They were. So if everyone want to review, if we need to discuss it, if not, we need a motion and a second to accept these and then I'll sign after.
So there are just a couple that have
Mhm.
revised dates of 9/7/23. The internal cash control.
Tim, did you want to, these are your policies. Would you
Yeah.
like to address these?
And let's see,
With me.
You want you
Um,
guys?
The return check one. We have extra copies.
I think that there were a couple, let's see, I think that might be,
The internal
here's
auditor.
11/10/22. I think that would be old. And there's one,
Just
that might be a different.
Just really quickly, there are certain policies that have to have the board chair, the board's chair signature on and board approval. The first one I'll just go through really fast will be the one that says bad debt policy. That is just a policy that says once we consider a debt uncollectible, we just have to write it off. And basically we just need, basically that's what that says. Also, it says that once a debt reaches a certain amount of aging and over $50, we can turn them over to debt set off, which means we can intercept their state tax returns or state lottery winnings. So the whole county actually has that program throughout its tax department, health department, and admin as well, EMS as well. So, any questions on that one?
There wasn't any changes. If you look on the back page where it says review dates,
Yes.
it was reviewed September the 11th of 23.
No revision.
So there's no revisions on that one.
The one that was, this one was revised. I'm not sure why that was revised. It shouldn't have been. It's return check policy, just as a policy saying that we charge $35 for a return check from the health department. Any questions? No. The internal cash control policy, I don't believe there was any revised. It is a revised. I apologize. To that, that's just a policy that tells us that we have to operate with checks and balances. In other words, I can't do several different duties at the same time. I have to have my staff who does those daily duties. We have to do an audit of all the cash boxes, petty cash boxes that's up front in management support. And also actually who can get in our safe, who cannot get in our safe, all that kind of auditing cash control things. And I think the setting fees policy, I went over last meeting that we had, how we set fees, so that has not changed. And I think the only other one was I think I missed one, setting fees policy, no, fee and eligibility. Fee and billing, okay. And that policy just shows how we actually set our fees, not set our fees, but how we do eligibility for clients and how we charge them on a sliding fee scale. So. Any questions? I know that's a lot of information, I'm sorry. I'm right here if you need to ask any questions.
All
you very
right,
much.
we need a motion in a second to adopt these policies, the revision and the reviews.
I couldn't find motion in
Oh, what, that's Siri.
I'll make the motion.
Okay, we have a second. A second. All right, we have a motion in a second to accept these policies. All in favor say aye.
Aye.
All opposed, like sign. The ayes have it and the motion is carried. All right. So we are at the informal discussion. Is there anything burning? Anybody want to say?
I want to bring up there's a golf tournament, not this coming weekend, but the next weekend held at Scotch Meadows. It's the third annual, and it's to raise money for the children's hospitals in North Carolina and surrounding. The Live Like Madison golf tournament that several of the teachers and principals and people got together and formed it's not an LLC, but I forgot the name of it, but it's a government sanctioned entity to where they don't have to pay tax, but they still have to report back, et cetera. And I know that Maggie Wells and others have put it together for the child. And she succumbed to sarcoma of the leg and was just an adorable child. And I think everyone's seen the symbol of the tournament and the fundraiser with the pink flamingo with the leg up in the air because it symbolizes hers. And plus she loved pink flamingos, is my understanding. But my wife and I are sponsoring a force, and my son's coming to play with 3 med students, and we're housing them for the weekend. And we're excited they're coming, and we're excited to be able to support. We always have, but this is a bigger support for us. And we're happy that the monies are going where they are because they actually just, they buy teddy bears, they buy equipment. They ask these pediatric hospitals what they need, and they allocate the monies, and it's all on the up and up. A board approves everything, and some of the board members physically drive these things out and present them. They had to stop some during COVID for some of those things, but I just wanted to let everybody know about it. I know that it has raised money like most would never believe here. But people drive in from all over to play in that tournament. And I'm not a golfer. I did play for the first time a few weeks ago, but my son enjoys it when he gets that little bit of time from med school to play. But I think those people who come out and support that are just helping the overall
Is there a
situation with the.
Is there a flyer for that? A flyer, like an advertisement?
Like a flyer.
They're all around, but we can
Okay.
get one.
Okay.
Yeah, we can get a poster over here or something.
Know some golf.
Definitely let us know.
Oh, yeah. Oh, definitely.
Yeah. Okay.
Thank you for sharing that.
Yeah,
Very worthy cause.
I know her dad.
And the parents, the
Yeah.
mother teachers in the school system is still here, and they're just great family, and
Mhm.
you know, it's great cause for us to support such a thing.
Okay. Kids always bring us together. All right, you know I can't see. Is it 7:45? It's like military. It's only 6:45.
It's 6:45.
All right, we did good. Okay. So we're gonna adjourn this meeting. 6:45. All right. I went too fast.
You did just right.
Hmm.
A lot of stuff I did.
Yeah.
I was like, wait a minute.
No, it's
Cause I told my
weekend.
son it's 9 o'clock.
Um,
Oh, like the last weekend in October.
I thought, you know, I can't see them.